Good afternoon, everyone. I'm Reem Tariq with the National Environmental Health Association. Thank you for joining us today for the second installment of the CHAT webinar series, which stands for Communication in Environmental Health and Tracking. The focus of this webinar series is to explore different communication and outreach strategies to facilitate a tracking program's engagement with, say, traditional partners and non-traditional partners, to impacting policy and working effectively across divisions. Also, I would like to inform you that this webinar is pre-approved for 1 hour of NEHA continuing education. So for those of you joining the webinar that hold a NEHA credential, that's something that you can look forward to. The focus of our webinar today is to explore communication tools and strategies for tracking programs to work across divisions. This webinar features Vermont Tracking Program and their work on Lead in School Drinking Water Pilot Project. The speakers will provide a detailed overview of their communication strategy and insight into how to best engage with partners across divisions. So during the first part of this webinar, we will hear about the background information on the Lead in Drinking Water Pilot Project. This will be followed by a step-by-step understanding of the communication toolkit applied for this project. And lastly, the lessons learned from this project and future work will be discussed. The webinar will conclude with a Q&A session. Before we begin, though, a bit of housekeeping. All webinar participants will be in listen-only mode. This webinar is being recorded, and if you're not comfortable with this being recorded, you can disconnect at this time. There will be a Q&A at the end of the presentation, so we will hold all questions until then. Q&A will be conducted via the webinar chat box, so please enter in any questions you might have via the chat box throughout the webinar, and we'll address those questions at the end of the presentation. With that, to ensure that we have enough time at the end of the webinar to take your questions, we'll go ahead and get started. We have 3 speakers presenting today, Amelia Ray, Michelle Thompson, and David Grass from the Vermont Tracking Program. First off, we have Amelia Ray. Amelia is the Information Director for the Environmental Health Division at the Vermont Department of Health. She has worked with the Environmental Public Health Tracking Program on program marketing and outreach for the past 4 years, including the Lead in School Drinking Water Pilot Project. Amelia has an MA in Environmental Studies from Prescott College and a Bachelor of Science in Natural Resources from University of Vermont. Previous to this role, Amelia was the Public Information Officer and Water Conservation Program Manager for a water district in Southern California. We also have Michelle Thompson presenting. Michelle is the Program Manager for the Envision Program, School Environmental Health at the Vermont Department of Health. The Envision Program was created as part of the School Environmental Health Act to address environmental health issues in schools and stuff. The Lead in School Drinking Water Testing Pilot Project was conducted under the umbrella of the Envision Program. Michelle has a Bachelor of Science degree in Environmental Engineering from Clarkson University and an MPH in Occupational and Environmental Health from Tulane University. Last but not the least, we have David Grass. David is the Environmental Health Surveillance Chief at the Vermont Department of Health. David has earned his PhD in Climate Studies, Atmospheric Science, and Environmental Health at Columbia University. He oversees the Environmental Public Health Tracking, Climate and Health, Radon Indoor Air, and the Envision School Environmental Health Programs. In his work for the Health Department, David has reviewed the potential health risks of next-generation fighter jets and industrial wind turbines. He also played an important role in managing the data collected during the Health Department's Lead in School Drinking Water Pilot Project last year. So with that, I will turn it over to you, Amelia. Go ahead.
Hi. Thanks, everyone, for joining us today to talk about Vermont Tracking's work with the Testing for Lead in School Drinking Water pilot project. So I'm Amelia, and I'm here with Michelle and David. And first we're going to talk about, Michelle will talk about why we did the pilot project and give you a little bit of background and context of the project. And I will go through a step-by-step process of what our communication strategies and tools were for this pilot. And then David will wrap up with what we learned. So first I just wanted to provide this list of our partners just to give you a little bit of context, since we will be referring to them throughout this presentation, so we just wanted to list them here first. So we, this project of course had a large collaboration with both health department programs and also with other state agencies besides the health department. So as I mentioned, we'll talk more about their specific roles, but first I just wanted to mention that in the Environmental Health Division, besides the tracking program, there's the Envision program, Healthy Homes, and Private Drinking Water program. The Envision program was integral in planning the pilot, as well as providing guidance to schools before, during, and after the pilot. The Healthy Homes Lead Poisoning Prevention program provide data in the criteria to select the schools for the pilot, and also provided guidance for healthcare providers. The Private Drinking Water program was involved in providing free drinking water test kits to families when there was elevated lead found, and we'll talk about that more a little bit later. And then our public health laboratory is in a different division than those other programs, but they were a partner in this as they analyzed all of the samples. And then our two state agency partners were the Agency of Education and Agency of Natural Resources. The Agency of Education played a role in encouraging schools to participate in the pilot, and then the Agency of Natural Resources was integral in providing remediation strategies and technical assistance to the schools to help them find solutions if there was elevated levels found. So next I'll turn it over to Michelle, and she will talk about the pilot.
Thanks. So we know that lead's a toxic metal, it's harmful to human health, and lead can harm anyone, but children under the age of 6 are at special risk. Children are most susceptible to the effects of lead because their bodies are still developing. They absorb lead more easily than adults do. And in 2017, 480 children in Vermont were poisoned by lead. While a major source of lead poisoning in Vermont children is paint, lead in plumbing pipes and plumbing fixtures can also add to their overall exposure. Lead in drinking water has also received increased national attention from widespread drinking water contamination that was found in Flint, Michigan. And many states across the country have initiated or are in the process of initiating programs for testing for lead in school drinking water. In our region here in the Northeast, Massachusetts has initiated a voluntary program to test water in schools for lead, and New Hampshire and New York have also passed legislation requiring schools to test for lead in their drinking water. Lead can still be present in a school's drinking water in spite of several legislative and regulatory efforts to remove lead from drinking water on both the state and the federal level. Lead can get into drinking water as it moves through older pipes, plumbing fixtures, or solder that contain various levels of lead. And since many Vermont schools are in older buildings, they're more likely to have lead in their plumbing. Plus, water that sits in pipes and plumbing fixtures when school's not in session can contain higher levels of lead. Some schools are already required to do some lead testing as part of the federal lead and copper rule, and two things determine whether a school is required to do some lead testing. The first thing is where their water comes from, and the second thing is how many people are served by the system. And here in Vermont, about 150 schools routinely test for some, but not all of their taps under this requirement. Working on this collaborative project, the Vermont Department of Health, the Agency of Natural Resources, and the Agency of Education set out to build the state's capacity to support schools that test their drinking water for lead, and to gain insight into how prevalent elevated lead levels may be in drinking water in Vermont schools. So moving into how we conducted the pilot, we had 16 schools that were served by public water systems in Vermont, and we took into account a number of things to make sure that we weren't focusing on one county or one region in Vermont, that we were really getting a good set of schools for this pilot. So we considered socioeconomic factors, the size of the student body, whether the facility hosts a pre-K program, if the school was on a public water supply. All of these schools were on public water supply. Some of the schools had corrosion control, and some did not at the public drinking water treatment facility. And we also looked at rates of elevated lead levels in the community. The testing protocol that we used in the pilot was largely based on the Environmental Protection Agency's 3 T's for reducing lead in drinking water in schools guidance document. And in doing this, we also were able to give schools a lot of assistance, helping them develop school-specific plumbing profiles, sampling plans that they could follow, and we also provided templates to help schools notify parents, guardians, and staff about the program, about the results, and the testing that was going on. And Amelia will talk more about those things. We also provided the schools with training on sample collection, and the test kits, the sample analysis, and the transportation of the samples to the laboratory were all included as part of this. And then with the help of the Department of Environmental Conservation, we were able to give schools some really good technical assistance about interpreting their results and what remediation strategies they should use. The number of samples that were collected depended on the size of the school. The number of taps that were used to provide cooking and drinking varied across the schools as well. Almost 900 taps were sampled. The vast majority of those taps were classroom faucets and fountains. Almost 900, we also sampled a number of bottle fill stations, hallway fountains and water coolers, as well as taps in the kitchen, staff room, and nurse's office. Samples were generally not collected from other locations unless it was noted that they were used for cooking and drinking. So in a couple cases, there was a bathroom that the school staff knew kids fill up a water bottle out of this fixture, so that was sampled. In total, about 1,450 samples were analyzed. About 900 of them were first draw samples, the first water to come out of the tap after 8 to 18 hours of inactivity. And about 550 were flush samples, where the water was run for 30 seconds before collection. One 10-minute flush sample was also collected from each school. And this differs from the 3 T's guidance, but it helped us to ensure that the water that was being supplied to the school building was okay, and that we would know if any issues were found, they were building related and not related to the water supply. Samples were collected by the trained school personnel. They were sent to the health department laboratory for analysis, and once results were available, the health department sent a report to school administrators summarizing the results and making recommendations to reduce exposure to lead in the short term if necessary. So what did we find? Because there's no safe level of lead in the body, a Vermont Health Advisory level of 1 part per billion had been established. which is consistent with the American Academy of Pediatrics recommendation that taps in schools should not exceed water lead concentrations of more than 1 part per billion. Lead was detected greater than 1 part per billion in the drinking water of at least 3 taps in all of the 16 schools. We also found elevated lead levels greater than or equal to 15 parts per billion in 1 or more tap at 5 of the 16 schools. And 15 parts per billion is the federal action level for lead in public drinking water. And this is something that's established as a level for treatment of a public water system, and it's not a health protective level, which is why we have the Vermont Health Advisory level of 1 part per billion. Any lead levels found to be at or above 15 parts per billion were immediately addressed. Schools were really responsive, and they immediately stopped using the tap, the affected tap for cooking or drinking by either turning off the water that was supplied at the tap or installing signage with pictures that instructed, for hand washing only, do not drink. And the pictures were especially important to include along with the language because we were dealing in many cases with preschoolers, early education programs. The schools then worked with the state, and in particular the Department of Environmental Conservation, to find the best possible solutions to permanently lower lead levels. And by working in this partnership with the Department of Environmental Conservation, we were able to make sure that schools were not taking unnecessary or costly remediation steps. In all of these cases, the common source of lead in drinking water was determined to be coming from the plumbing fixtures, and this determination was made based on the first draw results being elevated and the flush samples being much lower, in most cases below detection. Where lead levels were found greater than or equal to 15 parts per billion, plumbing fixtures were either replaced or they were permanently taken out of service. And any case where a plumbing fixture was replaced, verification samples were collected in order to confirm that lead levels had been lowered by the remediation. In many schools, including those that had results less than 15 parts per billion, students and staff were also directed to drink from existing bottle fill stations because the sample analysis showed no lead detected in bottle fill stations that were equipped with proper filters. And then based on some of those findings, some of our recommendations, no school was found to have lead levels in all taps at or below the Vermont Health Advisory level. Because lead cannot be seen, tasted, or smelled, we recommend that all schools test their drinking and cooking water for lead. Permanent remediation is preferred and recommended, such as replacing plumbing fixtures and pipes with compliant plumbing fixtures and supplies. A lot of the schools had sinks and or drinking fountains in every classroom. Some rooms also had several sinks within one room, and not all of them were used on a regular basis, but they would be there and available to be used for drinking water at any time. And lead levels in drinking water can increase as the water sits in the pipes and the fixtures, so where possible, removing redundant or seldom used fixtures will reduce potential exposure to lead in drinking water. Schools that already have bottle fill stations should encourage their use and maintain the filters. Schools that do not have bottle fill stations could replace old classroom and hallway plumbing fixtures by installing a centrally located bottle fill station or a couple centrally located bottle fill stations that are equipped with appropriate filters. We know that flushing is a good practice to implement following weekends, holidays, or vacations, just because as the water sits in the pipes and the fixtures, the content of lead in the water can be higher, and taps that were not used regularly and had water sitting in the pipes and plumbing fixtures for extended periods of time in the pilot had lead results as high as 25,000 parts per billion. So regular use and flushing can help to reduce the level of lead in school drinking water. And lastly, it's important to be transparent and upfront with the school community about lead in school drinking water testing. Schools should notify parents, guardians, and staff before testing even begins. Samples should be collected until the notification. Samples should not be collected until this notification has been made. Once samples are collected and analyzed, results and planned action steps should be shared with parents, guardians, and staff as soon as possible after receiving results. And schools can use the sample notification letters that were developed by the pilot to make these notifications. And with that, I'll turn it over to Amelia, who will discuss some of these communication tools and strategies that we use.
So I will go step by step through the different phases of the pilot. But first, I'll just give you a little bit of a timeline here. So step one, we asked the schools to participate in the pilot, and that was in September of 2017. In step two, we announced the pilot, and that was in November of 2017. We started conducting the sampling from November 2017 through February 2018. Started getting results back from the lab in December of 2017, and then finally we finalized the report in September of this year. So the first step during this phase, when we were asking the schools to participate in the pilot, our primary audiences were the school boards, school administrators, and school communities, meaning the faculty and parents of the schools in the pilot. So we asked the schools to participate, and we sent them a letter, and the letter came from the leadership of the three agencies, the Department of Health, Agency of Education, and the Agency of Natural Resources. And in that letter, we also provided a frequently asked questions document where we had about 20 questions, and we kind of outlined what we were asking of the schools, why we were doing the pilot, why their school was chosen, what kind of assistance was offered, and as well as health effects of lead, and then also other potential lead exposure for kids. And then we, as Michelle mentioned, we provided letter templates for the school administrators to send out to their school communities to inform parents and staff and to be transparent about what the pilot was, and to also talk a little bit about, to answer some preliminary questions about what would happen if lead was found. And then also in these letter templates was a chance to do an educational moment about other potential lead sources, sources of lead exposure for kids in the home. So we also directed parents to our lead poisoning prevention webpage as well. And then perhaps most important was we provided direct contact for questions, and it was a direct line to Michelle and also to our division director, which I think is really beneficial for school administrators who might not necessarily have time and don't want to go through a phone tree or get transferred or anything like that. So providing that direct line of contact was pretty important. And then the second step, we announced the pilot, and during this phase, our audiences were the press, schools in the pilot, and also schools not in the pilot. We did the press release in November of 2017, as I mentioned, and we also at that same time published a web page. And on that web page, we have general frequently asked questions about lead in school drinking water, as well as specifics about the pilot. So this served as a place for schools in the pilot to go for more information, and maybe perhaps parents or faculty and staff of the schools to go find out some more information. And then on this webpage, we also we produced a step-by-step video on how to conduct, how to do a sampling plan, how to do the sampling, how to take the first straw and flush samples, and kind of walk schools through doing a project for those schools that were not in the pilot. So if they were interested in doing their own project, their own testing, that we provided that video for them, as well as all of the same resources that we provided to the schools who were in the pilot. And then, let's see, the next step, we coordinated and conducted the sampling. And during this phase, our audiences were the school administrators and the school designees, that trained school personnel Michelle was referring to. And we provided them resources using the EPA's 3Ts guidance, and gave them the plumbing profile questionnaire as well as sampling plans. And an important step here is we also provided one-on-one assistance going out to the schools and helping them develop their, to fill out the plumbing profile questionnaire, and then also to develop the sampling plans and show them how to do the first draw samples as well as the flush samples. And this here is an example of the sampling plan. So next was to communicate the results. So when the results started coming in, we needed to communicate them to the school boards, school administrators, the school communities, and also the press. We also had sent out directed messages to healthcare providers in service areas near 2 schools. There were 2 schools that had a high percentage of their taps with elevated lead levels above the federal action limit of 15 parts per billion. So we messaged to the healthcare providers in those areas, and this targeted message was more designed to give them guidance if a parent were to come and ask them about testing their child for lead based on the results from the Lead in School Drinking Water pilot. And the Healthy Homes program, Healthy Homes Lead Poisoning Prevention program, also helped to develop this messaging. And also we developed a frequently asked questions document for healthcare providers to help them kind of as a supplement to this as well. And we provided the results were compiled and they were sent to the school administrators, and we also sent them letter templates to send out to their school communities. There were 3 different scenarios. One was if it was below the Vermont Health Advisory level of 1 part per billion. The second was if it was above that health advisory level, but below the federal action level of 15 parts per billion. And then the third was if it was above the federal action level. So we provided those to schools so they could let their school community know what the results were. And then about 2 weeks after we had provided the results to the schools and school communities, making sure that the parents and staff were informed, then we posted the results on our webpage. And the private drinking water program, as I mentioned earlier, they offered free test kits to families at the 5 schools where lead was found above 15 parts per billion. And the health department generally recommends private well owners do a suite of 3 tests, home drinking water tests. So for the families of these schools that were on private wells, the drinking water program provided the full 3 test kits. And then for those who are on public water supplies, it was a lead-only test kit. And then the last phase, of course, was to report our findings and to make recommendations. So we did a press release in September to announce the findings and recommendations to the school board, the school administrators, the governor and state legislatures, as well as the press. And I do want to mention, too, that the press was definitely involved throughout this pilot from the beginning, from when we announced it, and then also when we were doing the pilot, and then also when we reported the findings. And we created a report that was also released at the same time, and this was authored by the Agency of Natural Resources as well as the Department of Health. And in it we have those recommendations that Michelle mentioned. And we also are continuing to provide guidance for schools who are not in the pilot. So if anyone has if any school has any questions or wants to do their own testing project, that we still have that information available on our website with the video and resources available. So with that, David will take it from here to talk about lessons learned from our partnerships throughout this project.
Thanks, Amelia. This is David Grass. My role on this project was one of data management. So I was the person who would receive the data from the lab, clean the data, conduct any quality assurance or quality control that needed to take place, and then transform the raw data into a summary table that could be shared with the school and that the school could share with their community. But that was pretty much the limitation of what I did. Mostly I got to stand back and watch as Michelle did an amazing job as the project manager and technical expert, really walking the schools through this process step by step. I also got to observe our division director, Lori Cragen, who was very involved and very hands-on with this project. And she was a real force in pushing to make sure that the pilot would be carried out in a rigorous way that would be as representative as possible of what we expected the results would be for the state in general. So as Amelia mentioned, what I'm going to be talking about is the lessons that we learned from this collaborative project. This has got to be one of the most rewarding collaborations that I've worked on in the 6 years that I've been with the Department of Health. And I've been trying to think in anticipation of this webinar, why that is. I think part of it is that we had very concrete outcomes. We knew that we wanted to test between 12 to 16 schools. It turned out that all of the schools that we approached tested. We knew at the end of the day that all the schools would be armed with the information of what the lead levels were in their school so that they could address any elevated levels that they found. And that was something that everybody could feel really good about. Sometimes with public health and making data available, you're farther removed from the tangible impacts. But here it was really easy to see the impact we were having, and that's gratifying. As I tried to contemplate and think a little bit deeper as to why this collaboration worked so well, I was reminded of this framework that people in social service organizations have made reference to called the collective impact model for social change. And reviewing some of the elements of the collective impact model or collective impact framework was helpful in understanding why this project works so well. So the first one was that the collaborators shared a common agenda. Everybody from the program staff level to the division leadership was on board. We were all excited about the goal of the project, and we're all sort of rowing in the same direction. And having that agreement in our motivation really made us a force to be reckoned with, so that when it came time to get approvals or to get our respective administrations to review and approve documents or the next steps of the project, that all happened relatively smoothly. And so that prevented the project from getting sort of drawn out or slowed down some of the things that have tripped up other projects that I've been involved in. We also had a real clear definition of success. We knew that we wanted to test between 12 and 16 schools. We wanted to make sure that the methods we used were robust and that the results of the testing would be defensible. And then at the end of the day, we would have documentation that would be publicly available that would make it easier for future schools that wanted to test their schools for lead. So there was no sort of question about what we were moving towards. Everybody understood what the goal was. We also had clear communication between the collaborators, and a key element of this was that we set up a SharePoint site. I haven't had great experience with SharePoint in the past, but here it was really easy to get it set up, and we were able to use it for documentation. And so as the results came in and the summary tables were generated, the final communication products were generated, we were able to put those in one central place so that everyone was working from the same final document, which really simplified things and was a real success. Finally, we had a clear backbone coordinating organization. So for this project, the health department fulfilled that role. I've been involved with other collaborations where there isn't sort of one primary agency that bears the ultimate responsibility for the project. And since everybody's sort of loaning their time to the collaboration, when there's something to be done, everyone scurries in order to avoid being tasked with responsibility. Here, it was clear that the health department had primary responsibility for the project, that Michelle had primary ownership as the project manager, and so the roles and the responsibilities of the collaborators were clear, but ultimately the health department and Michelle as project manager had accountability for making sure that the project progressed towards the goals. We also had the benefit of not being the first state to engage in a project like this. The U.S. Green Building Council published a white paper in November called Perspectives on State Legislation Concerning Lead Testing in School Drinking Water, and they enumerate 16 different laws that have been passed in the last few years on this topic. And so we had the benefit of being able to consult with those other states and those programs to see how they had approached testing protocols and communications products. We got to consult with them about what their experience was and what they would recommend. So that was a great benefit. We also had the advantage of having established relationships with many of the partners who we were working with because we had worked on them previously in other projects. We held their work in high esteem. And so we had a foundation of trust that we could build on. So when there were, disagreements about what our approach would be, ultimately we knew that we were going to come to some sort of consensus because we trusted and had respect for the people who we were working with. That prior experience also allowed us to better understand what our partners could and couldn't do. So for example, the Department of Environmental Conservation, their Drinking Water and Groundwater Protection Division is the regulator for public drinking water. And it was important for them that it be really clear from the outset that the testing that we were doing at schools was not part of their routine monitoring program. And so we understood and knew that the health department needed to take the lead and that we needed to be clear with water suppliers, with schools, and the laboratory to avoid any confusion so that we weren't creating a headache for their regulatory program. Finally, I want to acknowledge the support that we had from the National Tracking Program, which pays either in part or in whole for for some of Michelle, Amelia, and my time. Certainly they paid for the time that we spent working on this project. The tracking program also paid for the drinking water analysis, and that certainly facilitated getting the project off the ground. Now that we've completed the project, we have a substantial amount of guidance on our Lead in School Drinking Water website to assist schools that have opted into testing since the pilot was completed. We even had schools that, because of the press coverage that was going out, were volunteering to test while the pilot was ongoing. We're a lot more knowledgeable in terms of our subject matter expertise, so when we're getting questions for schools, it's easier for us to field them. Admittedly, though, we're a small state, and this was a small pilot, so we know we still have a lot to learn, especially from those states and jurisdictions who have gone before us in implementing programs like this. So we look forward to hearing your feedback and your questions. Thank you for listening, and we'll take your questions when you're ready.
Thank you so much, folks, all the presenters, Amelia, Michelle, and David, for that insightful presentation. Before we jump into the Q&A, a few quick items of interest. This recorded webinar will be available on the NEHA website and learning management system within the next week or so. I will send the attendees information about applying for the continuing education credits also within the next week. And with that, we will move into the Q&A portion of this webinar. If you have a question, please feel free to type into the chat box. I've already received a couple of questions, so we'll do our best to answer all the questions in the time that we have remaining. So the first question that we have for you folks is, did this project lead to any impact on policy?
Hi, so this is David. So that's yet to be seen. The legislature will reconvene in January, and we will see whether there's legislation proposed that touches on this topic.
Okay, that is good to know. Another question that we have is, what are some challenges of working across divisions, and how was your team able to overcome them?
In terms of challenges, I'd say both within environmental health at the health department and within Department of Environmental Conservation, we have regulatory programs that are already in place. We don't want to interfere with any of the work that's already ongoing. So when presented with a new challenge or an opportunity, we can initially see it through the frame of those existing programs. I was struck by how many times the initial answer that we got to a question about how to test or whether we could test was not an affirmative, but then as we sort of discussed and pushed and prodded, that we could, clarify that the work that we were doing was not part of anyone's regulatory jurisdiction, and eventually get to yes, since ultimately everyone wanted to make sure that the water in the schools was free of lead. And so having that as the ultimate goal really helped us to be able to move things forward.
Thank you. Jackie says, thanks for the great presentation, and her question is, what were some of the reasons schools gave for not participating? And were you able to have conversations and encourage them to participate after initially declining?
So this is Michelle. We reached out to 16 schools that we had selected to participate in the pilot, and they all accepted. We did have a couple schools that it took a little bit longer to accept the invitation, and we had to do some follow-up with those schools with their superintendents to get them on board. But once they realized that this was going to be a proactive effort, that we were going to be working with them hand in hand to help if they found any issues, they came on board pretty quickly.
The impression that I get from talking to folks at Agency of Ed or elsewhere in terms of why there can be reluctance to testing is it's not so much about the testing, it's about the remediation costs. And the school board, you know, the town votes in the prior year at town meeting about what the school's budget is going to be. They're pretty constrained within that budget. And so having a budget item where you don't know what the results of the testing are going to be, you don't know what the cost of the remediation is going to be, is a difficult obstacle to get over. We were able to provide some assurances that if the cost of remediation were high, that we would try to find dollars to help out. Fortunately, the cost of remediation in the case of the schools that tested were relatively low. In fact, they were all less than $500 except for one school that installed a new bottle filler.
Thank you for that. I was going to ask a follow-up question on that is, once folks participated, did you lose any participants throughout the project? You might have touched on this, but if you could clarify, that would be great.
No, we didn't lose any of the 16 participants. We had some conflicts that came up just because the testing was taking place during the winter time. Conflicting priorities in schools, but between the time period of November through February, we were able to get all the 16 schools sampled and completed.
Thank you. Another question that we have is, do you have a process for identifying potential avenues for project promotion or for overall promotion and awareness of the Vermont Tracking Program? And if so, what does that look like?
I don't know that we've got a great answer. The tracking program does require us to submit a communications and partnership plan on an annual basis. Some of what we put in there is speculative for things that we think are going to happen, but oftentimes we are reactive, responding to environmental contamination episodes, so things that we can't really plan for. In terms of our avenues for promotion and outreach, we have a tracking newsletter that we send out on a quarterly basis. It's usually timed with when we're making updates to our Vermont Tracking portal. We have a tracking Facebook page that we will send out updates on. But for things that sort of have a higher level of salience, we're working with the Department of Health's communication office to put out news releases, health alerts for clinicians if necessary, and frequently, those things are high enough profile that they end up getting into the news.
Excellent. Thank you so much. So I have a question. When I was talking to a lot of the tracking grantees earlier this year, many expressed an interest in learning more about the use of social media for promotion. And you mentioned that you have a Facebook page. Did you incorporate the use of social media in your communication toolkit? And what ways did you find it to be most impactful if you did?
This is Amelia, and we did use the tracking Facebook page coinciding with the press releases and the release of the report. And there were also our health department, we have a main Facebook page for the health department, and they also posted on social media at that same time around announcing the pilot and then the report. So we, I'm not sure if that answers your question, Reem, but yeah, we did use it for those purposes.
Thanks, Amelia. Folks, if you have any other questions, please use the chat box to input those, and we'll give it a couple minutes to see if anybody has any questions. I guess, okay, we do have a question. From Catalina, she says, do you have any plans to scale up this project statewide or provide technical assistance to other states interested in doing this kind of project?
No, we don't have plans as of yet. We will be watching what happens in Montpelier. If there is legislation that's introduced, I suspect that a lot of the folks who collaborated on this project will be providing testimony to the state legislators in order to help inform the legislation that they craft. We have had some discussions about how we would translate the work that we did for a 16-school project to a larger number of schools. What worked for this very hands-on pilot would, some things would work well in terms of providing guidance documents. Other things we would not be able to do if we scaled up to a much larger project. For example, Michelle was very involved in doing sampling plans. I was very hands-on in digesting the raw data in order to produce the data summaries. So we've given some thought to how that might work, but we're sort of in a wait-and-see period at this point in terms of whether it'll be necessary to scale up. Irrespective of that, even if there isn't any legislation that's introduced, we have made it much easier for schools that are interested to test because the guidance documentation is there, the sample letters and the video are there, and we have continued to talk about how we could improve that documentation, where we could add greater specificity, and how we can make it better moving forward.
Thank you, David. So we're coming up on the hour, so I'd like to thank our speakers again and thank all of you for taking the time to join us. We hope you found value in today's webinar. Please be sure to fill out the webinar survey afterward. That information is really beneficial for us. Your feedback is important. Our contact information is listed in the chat box. My email's there, Michelle's, Amelia's, and David's. And we've got a couple of links that you might find helpful. And thank you again for joining us today, and have a great day.